to tonight's Q&A. The purpose of these meetings is to try to help the general public increase their knowledge about kidney disease, and sometimes it involves their own health issues, other times it involves a loved one or a friend. And the more we all know, the healthier we'll all be. And so that's really the purpose of these talks. And tonight we have a very, very special guest. It's Dr. Suzanne Nicholas, who's a professor of medicine at UCLA. She's an outstanding nephrologist. She's known throughout the United States because of the work she's done in many aspects of kidney disease, CKD, high blood pressure, too many to list. So I hope, Suzanne, you'll forgive me. But Suzanne has kindly agreed to join me tonight to address some of the questions you might have. And specifically, she's going to be talking about high blood pressure, something that millions and millions of Americans have, and many of them don't even know they have it. And Suzanne will help address some of these issues, talk to you about perhaps personal questions you might have. And so we'll go from there. So Suzanne, thank you again for joining the meeting tonight and helping educate us on high blood pressure, or what we call medically hypertension. Very
hypertension. Well, it's absolutely my honor, Ira, to be here tonight, and I accepted your invitation wholeheartedly to do this because, as you know, this is a passion of mine. And I want to welcome everyone to this session. As Ira mentioned, we're going to talk about some important aspects about high blood pressure, also a little bit about diagnosis and treatment. And you've already heard a little bit about me. I am a professor of medicine, actually trained here in clinical nephrology at UCLA, actually with Dr. Kurtz. So that was a few years ago. I won't tell you how many years because then you'll know both of our ages, so we won't do that. And I've also been trained as a hypertension specialist. So I'm sought out actually through my colleagues referring patients to me, and also for patients looking me up on the internet and seeking me out for management of their high blood pressure. So what exactly is high blood pressure? Well, high blood pressure is defined by the World Health Organization as a condition where the pressure in your blood vessels is just too high. And you can imagine what this looks like, right? You see the blood vessels of the blood that's flowing through the vessels here in this image, and you could think about it as pushing against the wall. Another way of thinking about it is like the force of blood pushing against the walls of your blood vessels at a pressure that's higher than normal. So that, in essence, is what high blood pressure is. And you've heard the term hypertension. I'm sure many of you have heard this term hypertension. So that's usually the sort of medical terminology of hypertension, but really it means high blood pressure. And when we talk about that, you've already heard that there are many people in the United States that have high blood pressure. So what does that look like? In fact, almost 50% of all US adults have high blood pressure. Think about that. That is like an astounding number. It means that if you're in a room that's full of people, every other person you're looking around you might actually have high blood pressure. And that's pretty bad news, but actually the news is even worse when you think about it, because of those individuals who have high blood pressure, 20% of them have their blood pressure controlled. And more than 75% of them will have their blood pressure that's not controlled. So with that in mind, it means that really the majority of us need to understand what high blood pressure is and to educate ourselves about how to best manage our blood pressure. If we don't have high blood pressure, to make sure we don't get it. But if we do, how best do we manage and control that high blood pressure? So we'll talk a little bit about that tonight. What are some of the possible causes of high blood pressure? You see this pretty image here on the right, and it really describes individuals who indulge in excessive alcohol consumption, particularly more than 2 drinks per day, physical inactivity, cigarette smoking, obesity, as well as older age. And I think that as we all get older, all kinds of things start to happen to us, but Certainly, older age is also a risk factor for having high blood pressure. It doesn't mean that maybe you've heard this years and years ago from physicians that, when your blood pressure is elevated because you're older, you don't need to manage it. That is absolutely not true, because you do incur risks that we'll talk about even when you're older if your blood pressure is elevated. And of course, chronic kidney disease, which is what we are talking about today and what Dr. Kurtz talks about every month, or even long-standing diabetes, is associated with high blood pressure. It's part of the natural history of having diabetes. A family history of high blood pressure puts an individual at risk for having high blood pressure as well. Certain medications can contribute to high blood pressure. Licorice, for example, ephedra, which is also known as mulled wine, and also St. John's wort. And I'm sure there are many others too. And stress. And that stress, everybody's under stress, right? Particularly in the world that we live in today. And so we want to make sure that we're all engaging in strategies to continually, on a daily basis, reduce stress, because indeed, stress can contribute to high blood pressure. Very good. And high salt diet, something that probably many of us are guilty of, by adding additional salt to our food, sometimes even before you taste it. So chronically using more than half of a teaspoon of salt or so per day in your food can contribute to high blood pressure. And some individuals are more prone to having high blood pressure when it comes to their salt intake. So want to be very cautious about that. Some of the consequences of high blood pressure are, and I'm sure that you've already heard this, stroke. You can lose your vision. You can develop heart disease that can lead to heart failure, have heart attacks, sexual dysfunction, and of course, kidney disease. All possible consequences or complications from having chronic high blood pressure. There are actually two forms of high blood pressure, which many folks aren't aware of, right? One of them is called primary hypertension, and that refers to when you have high blood pressure that does not have a single or distinct cause, meaning that there are multiple causes, or it's multifactorial, as it's said, in terms of the causes of high blood pressure. It's also known as essential hypertension or benign hypertension. And that term benign hypertension is in fact a misnomer. Nothing about hypertension or high blood pressure is benign. And then there's secondary hypertension. And that's where your high blood pressure might have a specific identifiable cause, but it turns out it's only a small minority of individuals who have hypertension that may have secondary hypertension. And the vast majority of individuals have primary hypertension or high blood pressure that is other than essential hypertension, I should say name, and that most people are being treated for when they go to their physician. And that's essentially the one that we'll talk about today, primary hypertension. Maybe Dr. Kurtz will invite me at another time to talk about secondary hypertension, because that's a whole other discussion. So which organs can be affected by high blood pressure? I think you've already seen some of that in my earlier slide. The brain, and the consequences are stroke or a transient ischemic attack, dementia, or retinopathy, which is a condition that affects the eyes when you've had high blood pressure chronically for some time. The heart can be affected. You can develop heart failure, as we mentioned, atrial fibrillation, or enlargement of the left ventricle. And of course, the kidneys. There's this condition called hypertensive nephrosclerosis, and that's a mouthful for anyone, even for a nephrologist to say. But it refers to that specific condition within the kidneys where the blood vessels within the kidneys are significantly affected, leading to chronic kidney disease over time. And so it's called hypertensive nephrosclerosis. And of course, the blood vessels. So within the heart itself, the blood vessels within the heart can be affected, leading to angina or chest pain or myocardial infarction or dissection or disruption of the aorta, the large vessel that that feeds the heart, or the peripheral vasculature. And so, knowing this as a background, we are talking today about treating high blood pressure, right? So you understand what high blood pressure actually is, understand some of the causes or some of the risk factors for high blood pressure, and you go to your physician and they're always asking about your blood pressure, what medications you're on. Well, what are some of the benefits of treating high blood pressure? Clearly, we know a large percentage of individuals across the United States have high blood pressure, and even globally, that a large percentage of patients don't have controlled hypertension. And so you want to be part of that 25% that have controlled blood pressure to be able to enjoy many of the benefits of having controlled blood pressure. And really, the goals of treating high blood pressure is something that makes total sense. It's to reduce the risk of damaging the organs and even causing death. We know that significant heart disease, like myocardial infarction or stroke, can actually cause death. And so, if you can manage your blood pressure, you reduce the risk of these organs being damaged and dying from this. Kidney disease can also cause death, and you've heard Dr. Kurtz talk about that. And so, over time, we really want to manage blood pressure so we reduce its effect on your kidneys. Heart failure, we talked about, kidney disease, stroke. And those are the big buckets, right? And so, knowing this now, I think everyone's probably thinking, well, okay, what's the best way to know if I have high blood pressure? That starts with measuring your blood pressure and measuring it accurately. So you may go to the clinic or you may go to a doctor's office and they measure your blood pressure every time you go there for the most part, but you want to be sure they're measuring correctly. And if your doctor asks you to measure your blood pressure at home, you also want to be certain that you're measuring correctly. And probably the first step in this process is making sure that you have the right type of tools, right? The right type of monitor to measure your blood pressure. Long ago, we used, like what you see on this picture, the gadget that's on the wall that had mercury. We don't use those anymore, right? We use something that's very simple that comes with an arm cuff, and that's the one that I recommend. And there are many different kinds of blood pressure monitors out there on the market, but not all of them are validated. The one that I recommend is called Omron, and it's spelled Omron. That's what I recommend for all of my patients. Why? Well, because that's the monitor that's used in clinical trials, and it's validated. And there are a number of Omron blood pressure monitors that are out there, and they keep improving the technology all of the time. And you can purchase these types of blood pressure monitors at different prices. They've got monitors that actually record and remember the blood pressure readings for several days and even months that you can use. You can purchase over the counter at any pharmacy and use it at home using the technique that I'm going to describe to you right now. And as you can see, this individual is sitting in a chair. Her back is supported. And you can't see her feet, but your both feet need to be on the floor. And you need to be sitting in that position and relaxed, typically for about 5 to 10 minutes, optimally in the morning, just after waking up. You can, if you want to, go to the bathroom, come back and sit down in a chair. Put the cuff around your arm, and then it's usually automatic. You hit a button, it inflates, and it will tell you your blood pressure reading. Some of them even tell you your heart rate, okay? And that's the number you want to write down. Now, typically, when you come to the doctor's office, they may measure this once and they record the readings. The right way to do it really is to do this at least 3 times, about a few minutes apart. And then we usually average the blood pressure readings. But if you're having really good, consistent blood pressure readings every day, then typically there's no need to keep repeating it. I recommend, though, that if your blood pressure is well controlled and you have numbers that are fairly consistent on a daily basis, if there's a day where your blood pressure reading might be higher than usual or lower than usual, that's a really good time to repeat those measurements. Typically, what I found and what patients tell me is that, after they've waited a few minutes and they're well rested, that blood pressure reading actually comes down. And that actually is true, and that's what happens. Sometimes, though, when you come to the clinic, the nurse may take your blood pressure and it may be elevated. That's not unusual. Usually, remember, we talked about stress being a potential cause of high blood pressure, and you can imagine getting to your doctor's office, having to deal with LA traffic, for example, or any other stress that you deal with on your way to the doctor's office. Even smoking within 30 minutes or so of having that reading can contribute to that blood pressure reading being elevated. And that's why it's really important for you, if you have a history of high blood pressure and you're being managed, that you take control and you monitor your blood pressure and record those readings on a daily basis, and then bring those readings to the clinic, share those with your physician so that you can make an assessment of whether you're under good control, if your medications need to be adjusted, etc. Other things about your lifestyle that might be contributing to your blood pressure being elevated if it's elevated. So what's normal? Well, normal blood pressure is considered less than 120 over 80 millimeters of mercury. For some women, it might be a little bit lower, but that's usually the number that we go by. There are several advantages to monitoring your blood pressure at home. It really engages the individual in their care. For example, when you are talking with your doctor and your doctor may have prescribed a new medication or they've asked you to engage in certain lifestyle changes, you want to be able to determine whether those changes or the new medication is actually contributing to better blood pressure control. And the best way to do it is to see what those numbers are. So that really helps to engage the individual in their care. It empowers them, certainly, because it really tells them, I'm doing a really good job. This is great feedback. And it perpetuates those good habits. The feedback you get, you can respond with, yes, I'm doing a good job, or even take that back to your physician, and then they can let you know whether you're doing a good job or not. And it also helps with medication management. And when I talk about medication management, I talk about medications that you're taking for high blood pressure. And typically it's prescribed in a certain manner. You take it either once a day or twice a day, maybe at night before you go to bed, or in the morning when you wake up before you have breakfast. And if you're doing that differently from the way it is prescribed, you'll be able to know with those blood pressure readings that you're monitoring at home whether you're doing it right or not. And that's really good information for you to take back to your physician so they can have a discussion with you about some things, maybe even minor things that may need to be changed to help to tweak your blood pressure. So a number of amazing advantages for home blood pressure monitoring. And in the Q&A, maybe some of you can tell me, if you're doing your home blood pressure monitoring and how that helps you and how it helps your doctor in terms of optimally managing your blood pressure. So this is a little bit busy slide. And what it tells us is about the staging of high blood pressure, right? I've already told you what normal blood pressure is. So anything greater than that 120 over 80, the systolic blood pressure, which is the top number, the diastolic is the lower number, that when it goes up, it becomes elevated. But it doesn't mean that you have hypertension until it gets into that range that you see here in the lower part of the slide, where stage 1 hypertension is where the systolic number is between 130 to 139, or the diastolic is between 80 to 80. Then stage 2 is much more advanced, more serious, where that top number is 140 or greater, and that bottom number is 90 or greater. So a couple of the things to know about this is when your blood pressure is elevated but not yet in the hypertensive stages, that's when you want to make sure and engage in lifestyle changes. At that point, medication usually is not recommended. It's not indicated. It's only when the blood pressure gets in the stage 1, stage 2 areas that medications are indicated. And we'll talk about lifestyle changes. I actually have several slides on that I want to engage you in, and we really like to get your feedback on some of the things that you do to help in terms of blood pressure management, if that's what you do. Right, so as I mentioned, medical treatment isn't really indicated until the blood pressure gets way elevated over 130 and certainly over 140. It's not correct to accept elevated blood pressures if you're older, as had been accustomed many, many years ago, because as you get older, you still have increased risk of heart disease, stroke, etc., as the blood pressure is elevated. So you always want to try to get your blood pressure down within the range that is recommended for you by your physician. So what are some of the best approaches to treat high blood pressure? You really want to start with lifestyle modification. So what does that term mean? It really means engaging in strategies that are really completely within your control, within your lifestyle, that can contribute significantly to improving blood pressure. And then add blood pressure medications. So this is a great slide. I want you to take a look at this, and we'll go through each of these in a little bit more detail. But it really pulls together all of the different modifications of lifestyle that can contribute to improving your blood pressure, the systolic blood pressure in particular. Like stress reduction, if you're able to successfully reduce stress in your life, it can actually lower that blood pressure reading by 5 millimeters of mercury. And that could be significant and be the determining factor between being on medication versus not being on medication. Engaging in physical activity can reduce the blood pressure by 4 to 9 millimeters of mercury. Stopping tobacco use, smoking, can reduce it by 2 to 4 millimeters of mercury. Weight loss can reduce it also significantly between 5 and 20 millimeters of mercury. And of course, that will differ for different individuals. If you're able to lose 10 kilograms, or about a little over 20 pounds or more for each individual. And then sodium restriction. I think Americans in general are very prone to having high salt diet. And so if you're able to reduce sodium or salt on your diet, that can achieve lowering of your blood pressure by 2 to 8 millimeters of mercury. Moderate alcohol use can also have an impact. And the DASH diet, and I don't know if many of you or any of you have heard about the DASH diet, but we'll talk about that in a second. So let's talk about some things that you can do to engage in physical activity. Walking, biking, and this is aerobic activity. So you want to make sure that you engage in this activity for at least 20 minutes continuously a day. Some patients tell me, well, I walk for my job, but that doesn't count. Why? Because your body gets used to that walking for your job, and you really want to engage in concentrated, focused aerobic activity at separate times where your body's not as used to it on a daily basis, and maybe increase that to about 20 minutes or more per day as tolerated. Hiking, swimming, running also, and it's recommended that you can engage in any of these types of aerobic activity for about 150 minutes per week as tolerated for the individual. Not everyone can tolerate that many minutes. And then the DASH diet. And DASH stands for Dietary Approaches to Stop Hypertension. This is something that was instituted many, many years ago. And I think it's something that makes complete sense. And everything is shown here on this one diagram. And it includes, eating grains, and it tells you about 6 to 8 servings per day. Fresh fruits and vegetables, 4 to 5 servings per day. And then low-fat dairy, about 2 to 3 servings per day. Fats and sweets, excuse me, eating legumes or nuts and seeds, as well as lean protein. And I'm sure that you've heard Dr. Kurtz mention to you that if you have advanced kidney disease, when it comes to protein intake, that lean protein should be more plant protein than animal protein. Okay, so this is a good image for you to think about, to go back after this meeting, this discussion this evening, to assess how well you're doing in terms of your diet and what changes you might be able to make to improve your diet. That's something that's more heart healthy, more blood pressure healthy. How about reducing stress? Well, stress, there are many ways that strategies that we can engage in to reduce stress. Meditation. Some folks say, well, oh, no, I can't meditate. Well, meditation is actually not that difficult. And you start off slowly and you increase. And it's just about really clearing your brain of all of the stresses and concerns that you are undergoing at that time, and to really clear your mind. Yoga, listening to music, that's something that I do. Taking a walk, that's also something that I do. Or even talking to a friend, a good friend, of course. If things that are going on in your life that are causing stress, call a friend and just let them know what you're experiencing. Sometimes that friend can just be there to listen, to hear you, and even that in of itself can help. One of the other things that I recommend to patients is keeping a journal. You would be amazed how well journaling works. And what does journaling mean? I recommend this for many, many patients. I ask them to, get themselves a really pretty journal and a beautiful pen. And then every night before you go to bed, write down about the things that you've experienced during the day, and especially things that you're grateful for. And you would be amazed that those things that are going around and around in your brain all day, or maybe keeping you up at night, once you're able to wake up and write those things down, they actually end up on the page and not in your brain anymore. And it's a really an important, significant way to reduce stress, allow you to sleep at night and to get through your days. Of course, stop smoking, any tobacco use. And many of you have heard strategies to do that, like the patch, for example, and a number of other ways. And then losing weight, even modest weight loss can improve blood pressure. And you want to aim to achieve your goal weight for your age, your sex. And one way to look at that is your body mass index. And there are these measurements, the body mass index, that are targets. If you're underweight, that BMI would be less than 18.5. A healthy weight, though, is anywhere between 18.5 to about 25. And overweight is considered above 25 to about 30, 29.9. And above 30 is obesity, 30 or greater. So what is that BMI? Here's a chart that you can look up on the internet, of what it will tell you for a woman, what your BMI is, and you'll determine, and you can see in these colored areas where you fit, for your height, as well as your weight in pounds. And anyone can look this up. There are also BMI calculators on the internet that you can utilize. And this is what it looks like for men. Similarly, look at your weight and your height and identify where you are in the colored regions. And then determine what things that you'd like to do to actually change that and monitor it over time. So finally, I wanted to mention to you, and I'm not going to go into detail about how blood pressure medications work, because that's a whole other discussion. But I want to just describe to you and show you some different types of blood pressure medications, primarily because several of you may actually be managed for high blood pressure, or someone within your family or friend that is being managed for high blood pressure, and they may be on some of these medications. So there are multiple types of blood pressure. We call them classes of blood pressure medications that have increased over the years. And as you can see, this is a fairly long list. And in some regard, it's a good thing to have these multiple classes of blood pressure medications because, as I mentioned to you, primary hypertension, which is the type of high blood pressure that the majority of us may suffer from, is multifactorial. And so these different classes of blood pressure medications each work somewhat differently, so they're targeting a different mechanism that may contribute to your blood pressure being elevated. And it takes a certain amount of skill to be able to integrate and to utilize medications from each of these classes for optimal blood pressure control. And this is one of the things that I do, and for patients who come to my clinic, I go over the different classes with them for the medications that they're currently on, and maybe other medications that we're considering. I really want to educate patients about this because I think that knowledge is power. And if you know the class of medication you're on, and someone is trying to prescribe one of these, and I'm going to show you lists of these, if you're allergic to one, then you'll know that within that class, you should not be taking any medications within that class. But there are options in other classes of blood pressure medications that you could be eligible to utilize to achieve optimal blood pressure control. So the next few slides will just be lists that I'm going to show you. So captopril, these are the more common ones in the ACE inhibitor class. ACE stands for angiotensin converting enzyme inhibitors, and angiotensin is one of those hormones that contributes to the blood pressure being elevated. And these medications will block the mechanism of action or the function of angiotensin. Fosinapril, lisinopril, perindopril, and you can see here ramipril, benazepril. So these are some of the more common ones in that class. And then there are angiotensin 2 receptor blockers. So these receptors may be on cells in your body, and that angiotensin 2 can work on that to contribute to the blood pressure being elevated. And some of these sit in this class. Losartan is probably one that you may recognize, or valsartan. It's important, though, that if someone is pregnant or thinking about becoming pregnant, they should really avoid these medications within these classes. And then diuretics. These are what you know as water pills, right? They allow you to urinate more to get rid of excess fluid in your body. And you've heard Dr. Kurtz talk about edema. And so these types of medications are the ones that your physician would recommend for you if you're retaining fluid, and whether you have heart failure or advanced kidney disease, furosemide, bumetanide, torsemide, chlorothiazide, amiloride, hydrochlorothiazide, indapamide, metolazone, and triamterene. These are the medications that we recommend as diuretics for patients who have high blood pressure. And what we found is that as patients get older, it's important for them to have a diuretic on board, maybe in addition to an ACE inhibitor or an angiotensin receptor blocker to really get optimal blood pressure control. And then in the beta blocker class, you've got these medications, carvedilol and labetalol, maybe the ones that you recognize, or metoprolol for that matter. And then in the calcium channel blocker class, you've got amiloride, diltiazem, felodipine, and nifedipine. Those are the ones that you might remember or recognize in verapamil as well. And then the alpha blockers, doxazosin, that's one of my favorite drugs, prazosin, terazosin, and hydrochlorothiazide. Then the central alpha 2 blockers, agonists, are methyldopa, clonidine, which you can take as an oral medication or as a patch. It works really well if you're on multiple medications. Maybe if you're on clonidine, also known as catapras, if you're taking the oral medication, you can ask your doctor to switch to the patch. So you have one less pill to take And that patch will last you 1 week at a time. And then the combined alpha and beta blockers are listed here, excuse me. And then the vasodilators are shown here. Then I want to wrap this up and to provide you with a summary of some tips to ensure that you have good blood pressure control. Take your medications as prescribed by a physician. If they recommend that you take your blood pressure once a day, take it at the same time every day. If it's twice a day, take it at the same time every day. If it's at night before you go to bed, take it at the same time every day. And there's a reason for that. The reason is because when you take these medications, they build up in your blood so that they can function optimally. And so whenever you miss a dose, that blood level goes down and then you start again, right? So you don't want to run out of your medications. Not a good thing. And if you experience any side effects, tell your physician right away. Don't just stop the medication. As I've shown you, there are multiple classes of blood pressure medication that your physician can choose from. So if you have side effects from one particular drug, let your physician know so they can really replace it with something else in order for you to have optimal blood pressure control. Keep a really good running record of your home blood pressure readings and definitely share that with your doctor. And with that, I want to say thank you for your attention and happy holidays, and we're going to open it up for questions.
Thank you so much. That absolutely wonderful talk. And I think we all recognize Suzanne's expertise and knowledge and ability in able to take such a complicated subject and make it so simple and clear for a lay audience. So on behalf of everyone on the call, I want to deeply thank you for such a beautiful talk, Suzanne. Thank you so much.
My pleasure.
Right now, we'll open it up for those that want to ask Suzanne a question. So please unmute and perhaps show yourself
Yeah.
on the video. We'd love to get questions from you. Please go ahead. Anyone who has a question for Suzanne?
Don't be shy.
Don't be shy. We're here to learn from each other.
How do they figure out which medication to use?
I'm sorry, say that again, David.
How do they figure out which medication to use?
Good question. So really, that's for your physician to recommend for you. One of the important things is that the physician needs to know if you're allergic to any medications that you might have been on before. But usually they will choose one of those classes that I suggested, I showed you. Typically an ACE inhibitor or an angiotensin receptor blocker and a diuretic are the ones that we go for, your calcium channel blocker. But if you have other conditions, and the nice thing about treating blood pressure, high blood pressure, is that the medications that treat high blood pressure, they have this amazing ability to actually treat other conditions. So that when we're choosing the blood pressure medication, we're thinking about other, what we call comorbidities or other organ damage that you might have. So for an individual who has heart failure, in addition to high blood pressure, your physician will choose the blood pressure medication that you will benefit from for both of those conditions. If you have BPH for a gentleman who's older and have benign prostatic hypertrophy, there are blood pressure medications that actually help to reduce that prostate. So when you ask that question, it's really, it has a complicated answer because it depends on the individual. It depends on what other diseases or conditions that you might have that will dictate the blood pressure medication that will be right for you. Does that answer your question, David?
Well, I guess somewhat.
So it's individualized, and that's
Yeah.
really what I want to get across. I can't say to you, you should be on this or that, because one medication that I may say right now might not be the right medication for you. And the other thing too is, for me, what I aim for is to have patients on the optimal number of medications. Most patients require 3 or 4 medications. Why? Because as I mentioned, the cause of primary hypertension is multifactorial. So we're treating different mechanisms that contribute to your high blood pressure. And so we want to make sure that we have that right combination for you, but also that you're given medications where you don't have to take them 4 times a day. Who wants to take any medication 4 times a day? All you're thinking about all day is, oh my God, it's time for me to take my medication. Oh my God, I just missed a dose. So one of the goals for me when I see patients in my clinic is to adjust their medication list so that it's optimized for their blood pressure control, but it's something easy that they can follow.
Thank you, Suzanne.
Mhm.
Are there additional questions?
Yeah, what about low blood pressure? I apologize, I was 10 minutes late. I don't know if you discussed that when you started, but what about people who experience low blood pressure? What can they do?
So that's another discussion that we can have at another time, but certainly individuals who have high blood pressure and are experiencing low blood pressure, there could be multiple potential causes for that. Sometimes you may not be drinking enough fluids, and your term what's called volume depleted. So you don't have enough blood within your blood vessels to circulate around your body, to go to your brain. And so you may get lightheaded and experience low blood pressure. That's important to know. And that's why that daily blood pressure monitoring is so important. If you're an individual who is experiencing low blood pressure, then monitoring your blood pressure on a daily basis. And if you're having symptoms of lightheadedness or feeling faint, you can write that down next to that blood pressure reading. As we mentioned early on, normal blood pressure is 120/80 or lower. And if you're feeling lightheaded and your blood pressure is really low, maybe 100, and it's really, really low if it's less than 100, you need to let your physician know right away. And maybe the medications that you're on might be too much for you. There are individuals who start off being hypertensive or having high blood pressure who are being prescribed medications and maybe, overweight. And they're engaging in weight loss activities and they lose a significant amount of weight. And then the blood pressure medications that they're on is too much for them. Because as I showed you, if you lose a significant amount of weight, like 20 kilograms, for example, your blood pressure can decrease significantly. And that's a strategy to manage blood pressure. So low blood pressure could be a complication when you're being maybe overtreated, or if you're not drinking lots of fluids and your volume replete and there's enough blood flowing through your body. And there are other potential causes of that may need to be evaluated by a neurologist, for example. But if anyone is experiencing low blood pressure, you really, even if you're being managed for high blood pressure, that's something you want to convey and to share with your physician as soon as possible. If you're very symptomatic, you've got blurred vision, that's something you don't want to wait to call your physician. You want to go to the emergency room so they can evaluate you immediately and then manage accordingly. Okay,
Thank
Cliff.
you. Thank you.
Thank you for that question.
Thank you, Suzanne.
What about when the blood pressure is normal during the day, but at the end of the day it's low?
So similarly, everyone is a little bit different, right? And that can happen in some individuals. That's something you also want to discuss with your physician. It may be that we need to adjust when you're taking your blood pressure medication. Maybe you need to take your blood pressure medication at night, or maybe the medication that you're on is too much for you if it's on during the day and you're taking it either in the morning or even in the afternoon. We may need to adjust that because your blood pressure, we really want it to be controlled 24/7. 24/7, right? 7 days a week. So it's not just at one time of the day or another time of the day. And so that's really, really important to have that consistent blood pressure throughout. Typically, if your blood pressure starts becoming low and it makes you symptomatic, that's when you need to let your physician know.
Okay.
Thank you. Any other questions for speaker today? Suzanne, maybe I could bring up a question. What often occurs in the clinic are people who say, they get a different blood pressure at home. versus the clinic. And one thing that always comes up is, well, you're nervous in the clinic and that's why your blood pressure. But then we discuss things and think, well, is that blood pressure cuff actually normal? Is it giving the accurate reading? Do you have any recommendations for people to tell, should I throw my blood pressure cuff away? Should I get a new one? It's confusing to patients. The difference.
That's such an excellent question, Ira, because I actually probably talk about this every single time I'm in clinic with patients because it's almost routine, very, very common that patients, if you're monitoring your blood pressure at home and it's running, 120s or so over 80s, and you come to clinic, and as I mentioned to you, sometimes you're fighting with LA traffic, you get to the clinic and you sit down and you don't wait long enough to rest, and they measure your blood pressure and it's elevated. Is that true? Is that real? Well, probably not, because there's a right way and there's a wrong way to measure your blood pressure. So you want to make sure that it's being measured correctly. But also importantly, as I mentioned, the monitor needs to be calibrated. If you're using your blood pressure monitor routinely for years, maybe you need a new blood pressure monitor, or it needs to be calibrated. What I recommend, I've given you the name of the one that I recommend. So for some patients who've had their blood pressure monitor for many, many years, they've been using it, and the blood pressure readings are different from what we're getting in clinic, the first thing I ask them to do is to bring their monitor to clinic, and let's double check it. Double check the accuracy of your monitor with our monitor in clinic. We get our monitors calibrated routinely. That's important, right? So our blood pressure monitor will be able to tell whether your monitor is working well. And if it isn't, you can either send it back to the manufacturers to get it calibrated or just purchase a new one. A blood pressure monitor should be anywhere, cost about $60, $70, $80 or so, and you can purchase that over the counter at any pharmacy. So I think it's something that, patients typically are able to afford, because as you've seen, getting the right blood pressure readings, knowing that your blood pressure is controlled, is important because of the benefits that you can gain from it, but also you want to avoid the huge serious complications that we talked about.
Yes, and what Dr. Nicholas said is so important. It's important that you all check your blood pressure monitors with what people get in the clinic. So bring in your monitor. How often do you recommend, Dr. Nicholas? Once a year or twice a year? How often should they check whether the particular blood pressure monitor is accurately giving what the result is in the clinic?
I think that I know for our clinic, we do it every 6 months or so. That's really important because we use it all the time. But for patients, it really shouldn't go longer than a year or two. But I think it's important to look for the clues that will tell you, maybe I need to check my monitor. So if routinely, whenever you come to clinic and the readings that we're getting are lower or higher, they're very different from what you're getting at home, particularly after we've allowed you to rest, for 5 minutes, 10 minutes or so, and your blood pressure reading is remeasured. We want to be sure that the readings are consistent. There may be a couple millimeters of mercury off, but if it's significantly off, then that might be a clue to bring it in. And it's easy to do that. You could come into any clinic. It doesn't have to be your primary care physician. It doesn't have to be the nephrologist or the hypertension specialist clinic. Any clinic that you come to, because they usually will measure your blood pressure, bring your monitor with you and ask the nurse to double check the accuracy of your blood pressure reading. Now, it's important to know that indeed, some of those elevated blood pressure readings may be real. If you're having a really bad headache or blood vision, we're not going to question that elevated reading. We're going to make sure that you're seen in the emergency room right away. Okay, so those are the things that you want to think about. Just having that sense of what's normal, what's not normal, what symptoms that you can expect that's associated with elevated blood pressure that can complicate your life essentially. Those are the important things to keep in mind.
Thank you so much, Dr. Nicholas. Another question, though, that does come up is, I feel nothing. My doctor says I may not feel any symptoms. So that's one thing. The other is that my blood pressure is like the weather. In the morning, it may be different in the afternoon, maybe different at night. It may be different when I'm standing. It may be different when I'm lying or sitting. When should I measure it?
Yeah.
I have, it's very confusing. Should I measure it in the morning, the afternoon, at night? Should I measure it when I'm lying, when I'm standing or sitting? There's so many possibilities. I could come into you when I see you in the clinic with, 3 times a day, all three
Yes.
postures. Like I have a very, I'm a busy person. I can't measure it 3 times a day, lying, sitting, and standing. I'd come in to you with 9 measurements every single day. I can't possibly do that. What do you want to see when I come?
So thank you so much for that question. I love that question. It's something I address also very often with my patients. First of all, no one should be measuring their blood pressure multiple times during the day. Think about that. If that's what you're doing, that's a job. That's a job in of itself. And all you're thinking about is, oh, I need to measure my blood pressure. And guess what that does to your blood pressure? It rises that blood pressure because you're stressed. You're stressed. So this is what I recommend. I recommend that patients measure their blood pressure in the morning, right after awakening. Sometimes patients go to the bathroom, and that's fine. Do that, come back, sit down, as we've discussed, both feet on the floor, in a chair, back supported, and your arm is at the level of your heart. And you want to be sitting down for about 5 to 10 minutes, rested, not watching television, not arguing with your kids, but rested, and then measure your blood pressure. The other thing that I talk to patients about is the fact that physiologically, normally, there's a small discrepancy in the blood pressure in both of the arms. So when we start measuring blood pressure, I say measure it in one arm, write that number down, and then measure it in the other arm and write that blood pressure down. The arm that has the higher blood pressure reading, and it's just off by a few millimeters of mercury, that's the arm that you want to follow. That's the arm that you want to measure your blood pressure in routinely. And that's the arm when you come to clinic, you let the nurse measure your blood pressure in that arm. So you're not measuring your blood pressure multiple times a day. In the morning, right after awakening, is the right time. And there's a strong reason for that. The reason is because there's a circadian rhythm, a daily rhythm to your blood pressure. It's going to change because your heart is pumping as you move around. If you're going to run a mile, your blood pressure is going to be pumping. Your heart is going to be pumping. Your blood pressure may be a little bit up to get blood to your body. And so we want to make sure that there's consistency when you're measuring your blood pressure, because it can go up and down during the course of the day as it is supposed to. In the afternoon, during the day when you're busy, your blood pressure will be a little bit up because it's pumping, your heart's pumping harder, it's getting blood to your brain and your muscles. That morning, right in the morning, just before waking up, is the time of the day when the blood pressure is normally the lowest. And so if you have high blood pressure, so think about it. If you have elevated blood pressure and your blood pressure isn't being well controlled, that morning blood pressure just before waking up, it starts to surge. It goes up physiologically. So if your blood pressure is indeed elevated, when it does that normal surge, it's going to be even higher, and it puts you at risk for having heart attacks and stroke. So any individual who already has heart disease, kidney disease, etc., who've had a previous stroke, that morning blood pressure, right after you wake up, is really key to tell us that if your blood pressure is being controlled 24/7. And that's a lot of information there, because blood pressure is a little bit complicated, but when you think about it, all of it makes total sense. Bertha.
Yeah, did you say to take the blood pressure on the arm that is higher or
Yes.
lower?
Higher. Why do you think it would need to be in the butt? Because remember, you want to control your blood pressure, right? So you want to know if the one that's higher, you want to know that number. Because if you follow the lower number, then you're kind of not in reality, right? And you would not be able to optimally control your blood pressure. So the arm with the slightly higher blood pressure, that's the arm you want to use to follow.
Yeah, Dr. Nicholas is basically saying you want the worst case scenario. You want to know the highest it could be, not fool yourself into thinking you're okay and it's the lowest. So makes a lot of
Right. Makes sense.
Any other questions?
Actually, managing blood pressure, that's why I love it. Makes total sense. You know, and I could talk about this for hours. But I think we've gone over a lot today.
Are
Anyone
there
else
any,
questions for Dr. Nicholas?
are
Before
there any foods or beverages that would take salt out of your system?
Well, the diuretic that we talked about, furosemide, etc., those are medications that your doctor can prescribe to you to allow you to urinate more. And as you urinate more, it'll take more salt out of your system. But the better approach is to not take too much salt into your system.
input and output.
About that in one of your sessions.
You can either take in less salt, which is, as Dr. Nicholas was saying, the easiest approach, or if you do happen to take in more salt, the doctor can then give you pills to get rid of more salt. But the far simpler thing is just go on a lower salt diet in the first place.
And what goes with that is if you're taking more salt, you know, and you're going to the doctor and they give you the medication or the pills to get rid of salt, and you say, well, okay, the pills are getting rid of the salt, I'm just going to go ahead and eat my potato chips tonight. Guess what? The pills won't work.
Okay, well, I think because of the time, and we'll wrap up now. I want to deeply thank Dr. Nicholas for taking the time tonight. As all of you can see, she's an outstanding expert in this field, and we're deeply honored to have her tonight. She's a world's expert in high blood pressure, and I can't thank her enough for spending the time with us tonight. Suzanne, thank you so much for everything that you presented and all your expertise in addressing the questions, some of which were common, but others more complicated from people that stayed on the meeting tonight. So thank you again.
Thank you.
And if you have any questions, please email Leslie, and Leslie will, if you wish, address some of these questions with Dr. Nicholas, who confidentially will get back to you, because I'm sure some of you may not want to publicly address some of the questions with her. So thank you again for everyone for taking the time, and please spread the word. One of the goals of this meeting is for you to address some of the things you learned tonight with some of your friends and loved ones. So hopefully we'll increase not only the knowledge of kidney disease, but the knowledge of high blood pressure after tonight with those of you in Los Angeles and others. And again, thank you so much for Suzanne for taking the time tonight and helping us learn more about blood pressure. Thank you again.
My pleasure.
Thank
Thank
you.
you both.